when I realised how successful this stimulator was, I thought, why haven't they put that in me sooner? Because I understand from my physician that it's been done since the 70s. And the hospital pain unit I was attending was a teaching hospital, and you'd think they'd know about these things. So I was put through all those procedures when all the time I could have been given this, and it would have saved a lot more physical and emotional pain for me. To all patients suffering with chronic pain and not having treatment that helps them, they and their physicians really need to know about this as a treatment option, rather than putting through the turmoil of trying so many procedures and none working. If this is a treatment option, they really need to just go straight for it.
In Sharon's case, she had an emergency angiogram, and in the course of that probably got some femoral nerve damage, which resulted in neuropathic pain. Really very disabling, and in fact Sharon went on to develop a number of other widespread pain syndromes as well, which were being managed in London. As is typical with patients with severe disabling pain, there are quite a lot of features of psychological distress and being unable to cope. And Sharon was lucky enough to have been treated in London for the effects, if you like, of her pain. But she was still really left with quite high intensity pain on really quite a lot of opioid analgesia and other medications, quite sedated with her medications. She desperately needed some other modality of treatment in order to lead a normal life. And you have to remember that she was just in her early 20s then. So we talked about spinal cord stimulation, and I think from my memory she was quick to adapt and adopt this idea.